Hi, good morning, Mr. Miller. My name is Tammy, and I'm going to be your nurse today. Dr. Aber asked me if I would come in and speak to you about gout and give you some information about it. So gout, also known as gouty arthritis, is the most common type of inflammatory arthritis. It is a systemic disorder, and it's caused by an increase of uric acid in your blood. What happens is that uric acid builds up, and it forms these little crystals in your joints, particularly that big toe joint right there at the base of the toe. And that is what causes that severe joint pain, that redness, that swelling, and that warmth that you're feeling today. So it can be caused by medications you're taking, diet. Sometimes the body just makes an overproduction and it's more than your body can excrete. And so it causes that buildup. Unfortunately, you're right in that age range, which is typically found in males ages 40 to 50. It can also be found in postmenopausal women, but that 40 to 50 range of men is the most common. Some of the risk factors are obesity. It has a hereditary component, cardiovascular disease, chronic kidney disease. If you've been on long-term diuretic treatment, you might know that as a water pill. Alcohol use, particularly beer, and it's severe alcohol use. So they'll do these tests, these little blood tests, and it will test for this different stuff in your blood. And if you have an increase of it, it tells us that you've got some inflammatory thing going on. But there's another one called a serum uric acid, and if we consistently get a level of 6.5 multiple times, that gives us a definite, like, that's what this is. So we're going to run those tests for you today. Some of the treatment options, you have the acute, which means it's kind of a sudden onset and it doesn't happen like all the time. So that would be treated with NSAIDs, which are an anti-inflammatory drug, and corticosteroids also just kind of help get all that inflammation calmed down. Some things that you really want to do is prevent it. If you can prevent the flare-ups, that's the best thing to do. You're going to want to modify your diet. You want to eat what's called low purine. So purine is found in red meats, organ meats, seafood. Those type of things you're going to really want to eat a limited amount of because they can cause a flare-up really fast. You're also going to want to avoid any starvation diets, aspirin and diuretics, I guess are the water pills. You want to limit your physical and emotional stress. If you're having a lot of stress, you might want to consider some stress management classes. And then we really want you to get that fluid intake up. The more fluid, the more you're going to excrete that uric acid and kind of keep that stuff at bay. It's really important that you take your medication as prescribed. The doctor wants you to take this, let's see, he's going to have you on it right now about every 4 to 6 hours, and we just want to make sure that you take that, you take the full course, and just follow all those directions. And we really want to make sure that you're avoiding that alcohol, especially that beer. All of those things can cause that flare-up if you don't modify them. All right, thank you.